Hi, my name is Dr. Michael Veslak, and today I want to talk to you about a new and emerging field called integrative psychiatry. The goal here is to try to find the root cause and take a more personalized, individual approach to some of the mood disorders such as depression and anxiety. Wouldn't it be nice if you actually went to your doctor and they asked you questions about your sleep patterns, diet patterns, exercise, genetics, toxic exposure, previous concussions, rather than just taking a history, the subjective complaints, and providing you medication? In my practice, I've been practicing now for probably 40 years. I have seen a real change in patient complaints. Probably now one out of two, one out of three patients are having issues with some type of mood disorder, such as anxiety or depression. It wasn't like that in the past. It was we would see mainly musculoskeletal. Occasionally, there might be a complicated case that we thought was fibromyalgia, and now, due to a lot of different factors that I don't want to get into today, there's a lot of theories. There's just much more complex conditions that we're seeing in our office and that we have to figure out how to treat. So what I decided is I want to take a personal approach, try to find the root cause of these issues, and try to have a better success with my patients. So the common conditions that I see in my office are autoimmune issues, depression, anxiety, phobias. We have a lot of digestive issues. Fatigue is super common these days, and of course, inflammation coming from various sources. Now, in the past, when you went to a psychiatrist, the recommendations were based on your subjectives, what you told the psychiatrist, and then they would prescribe medication for that. There aren't really any objective measurements when it comes to prescribing these meds. So in functional medicine, again, our goal, I hate to keep saying this, but is to get to the root cause, to try to figure out the why part. And there are objective tests that we're going to go over just a couple today that can actually give you some insight to this possibly can be the root cause of your problem. So in our office, we like to run a CBC, a complete metabolic panel. We like to run hormone tests, sometimes iron tests, tests for inflammation like CRP and ESR, and then a stool sample, which is called the GI map test that looks for these hidden inflammations. And then probably our favorite test is what they call the organic acids test, where we're looking at metabolites in the urine and then amino acids in the plasma, where you can really kind of get a good snapshot of what's going on within the body. My patients, when they come in, they always, they tried a lot of different things. They just don't know where to start. It can get very confusing. And the reality is you need to have a really good approach. And I would say someone to guide you to tell you hey, this is your primary part that you need to fix, rather than just, taking a dart, hoping you're going to hit the bullseye. So is it the gut? Is it hormones? Is it methylation? Is it sleep? Is it nutrition deficiencies, toxicity, genetics? There are a lot of places that can be. That's why we want to run labs. We have you fill out specific questionnaires. We do a thorough examination evaluating the functional neurology part of the brain to make sure that everything is working properly. And then usually we have a pretty good understanding of, after seeing so many patients, of where we need to start, where we're going to get the most benefit and hopefully the fastest benefit. So research shows us now that the causes are not really chemical or neurotransmitter like we always thought and that we're trying to prescribe medicine for. The imbalances are primarily coming from outside the brain. They can be related to diet, such as sugar or white flour, gluten maybe. Sometimes dairy can create inflammation. Proper digestion is super important. You got to be able to break your food down and surely your protein to make the amino acids. Omega-3 imbalances are important. Zinc, vitamin D, copper. We want to look inside the microbiome to make sure there's not a lot of dysbiosis or overgrowth of bad bacteria that can create inflammation. Want to check hormone levels sometimes and inflammation, like I said. So we want to do a stool sample that looks at things like candida and parasites, and different things that are related to inflammation. And of course, we have to ask questions about the past, right? Any past concussion can show up 5 years, 10 years, 15 years later, where all of a sudden you start to have digestive issues. You can't figure out why. You start to get that brain fog. Pretty soon, panic attack or depression, and you're trying to figure it all out, and how the brain's, actually just trying to compensate for this deficiency that happened, maybe 10 years ago for some concussion. You want to look at sleep patterns, and of course genetics, things like the MTHFR, COMT, MAO. So our test that we like to run is, I talked about the Dutch test. Hormone insufficiency or imbalances create depression and or anxiety. That's been proven. So we want to look at cortisol levels, testosterone, estrogen, progesterone ratios. And this is our favorite test right here, the Dutch hormone test. It's a urine test. We also want to look at the inflammation with a stool sample. It's called the GI map, where we're looking at, as I mentioned, yeast, bacteria, inflammation, parasites. And then what I also love about this test, it looks at something called the SIGA. That's where, we say 78% of our immune system is within our gut. That is called the SIGA. We want to see how it's functioning. And then also, you probably heard, the majority of serotonin is made in the gut. You have to have a healthy gut to make these neurotransmitters. And then the NutriVal test is this is the organic acids test. It looks at oxidative stress, or your need for antioxidant support, mitochondria, how we produce our energy, how we take food and produce energy. Are we having any discrepancies there? If so, if you don't fix that, the fatigue isn't going to get better. We look at the omega-3 imbalances, and if the level of inflammation in the body. It looks at toxic exposure, and then finally it looks at methylation, or how the MTHFR primarily is working, folate, B12, and this test again tells us a lot of important information, even about amino acids, how they make the neurotransmitters. In a little bit, I would be providing a video that's going to talk about specifically the NutriVal, how it relates to mood disorders. And then, of course, genetics, like I mentioned, the MTHFR gene is probably the most researched gene out there. It's super important when it comes to neurotransmitters, detoxification, providing energy, blood clotting. And the COMT helps to break down your dopamine, estrogen, norepinephrine, epinephrine, MAO, helps break down the serotonin. These are important genes that you need to look at. But what's important to know is that genetics are not your destiny. They can be turned on and they can be turned off. So I'm super excited that I've now collaborated with Moxie Psychiatric Group in Westlake, and our goal is to try to get patients as healthy as we can, either by reducing their medication, getting them off the medication if that's their goals, and just having them make a healthier lifestyle, diet choices, and trying to find the root cause to get them healthier. So either we help them, or they have the conversation with their doctor to help them wean off their current medications.